Hi everyone, my name is Konnor. I'm one of the fourth year medical students here at UC Irvine in sunny Southern California. We are going to work through some micro board style questions. Microbiology on step 1 is incredibly high yield, really comes back on step 2 as well, to much of our dismays. But we're going to walk through a question that I feel like is really helpful, and we're going to walk through the sketch as well. So what I like to do is read the last sentence first. I feel like it primes me to what the question is going to talk to me about. At the same time, if it's something like, what is the mechanism of action of rifampin? I don't need to read the whole stem. I can just choose an answer choice right there. So I will read the last sentence first. I also skip the answer choices. I feel like it biases me a little too much, so I skip those. So which of the following is the most likely diagnosis? All right, so I know they're going to give me something, but right now, reading this, I don't know that this is a micro question. So let's read through. We have a 35-year-old woman. She has 4 weeks, so getting to be chronic, of persistent cough, fatigue, low-grade fever, night sweats, and 5-pound unintentional weight loss. So immediately that screams cancer to me. The weight loss with all the B symptoms, again, just screams cancer. She's also coughing up blood-tinged sputum. Okay. Not always with cancer, but we'll see. She immigrates from India and lives in a crowded apartment. Okay, so now they're trying to get me to think of other things, not just cancer. Crackles in the upper lobes, maybe a pneumonia. Chest x-ray shows bilateral apical infiltrates with a cavity. Okay. And they're really nice. And they tell me that the sputum smear is positive for AFB, or acid-fast bacilli. So now I know this is a micro question. Because if it was anything else, they probably wouldn't have told me acid-fast bacilli. So let's walk through this. Evidence for TB is a lot of things. The 4-week kind of history of presentation, the fatigue, the fever, the night sweats, the weight loss, the coughing up blood-tinged sputum, all of that screams TB. She's from India, lives in a crowded apartment, and just recently immigrated, as well as a cavity on the chest x-ray. So a lot of these things concern me for TB. Lobar pneumonia caused by strep pneumo. So the crackles in the upper lobe could be strep pneumo, but this has gone on for a while. And they tell me a lot of other things about immigration, her weight loss. That's not really strep pneumo. Lung cancer. So I was very convinced that this was cancer early on, just because 9 times out of 10 unintentional weight loss is cancer on board style questions. Lung cancer, again, the real reason for choosing this one is that they tell me that it's something stains for acid-fast bacilli, but still not as common to have this blood-tinged sputum with this immigration. It's possible, but again, just not enough evidence. Sarcoid, when in doubt, if you don't know the right answer, it's sarcoid, because sarcoid causes a lot of things. Yeah, around the right age in a female, but sarcoid causes a lot of other things than just lung pathology. And I don't remember anything about apical infiltrates and cavitations and all that with sarcoid. And then histo, or Ohio and Mississippi River valleys. Again, causes lung stuff, but not from someone who immigrates to India. I guess if she moved to Mississippi, sure, but not really. So of all of these, unlikely, possible, but unlikely, much more likely. And this just kind of smells like TB. So let's go through it. And it was TB, or Mycobacterium tuberculosis. I love the TB sketch. I think the kind of Western theme of it is super funny to me. So I go through this symbol viewer and just, it's been a little while since, I've thought of TB. So you can either click through or you can hover over or scroll down. I do like scrolling down. It's nice to read on this. So here's your acid fast right here, pulling out the mycolic acid, and same thing with this fuchsia stain for acid fast. So cool. I know that's acid fast. That's great. I keep scrolling through. What else is important that I need to remember? Okay. Bullet holes. Okay, so we have in primary TB most often in the middle and lower parts of the lungs based on where this is located. We get enlarged hilar lymph nodes. We get a Gone complex. Let's see here. Again, I'm just quickly reading, skimming, and really just kind of catching myself up on TB because it's been a little while. Yeah, you got the question right, but let's make sure we get all the other TB questions right too. So reactivation or secondary TB is upper lobe disease and cavitation. So they could have asked me, is this primary or secondary TB? And this is where this is helpful for me saying it's secondary. Primary TB is often asymptomatic. Secondary or reactivation TB like this, cough, hemoptysis, night sweats, all the stuff that we kind of talked about that our patient presented with. And then this one is really good. The combination of drugs for taking, for the combination of drugs to take for TB will definitely be tested. Everyone loves right therapy. That'll definitely be on there. But this was a little walkthrough of the parts of the TB sketch that I think are really important to refresh yourself on, because that's the high yield stuff. So primary versus secondary, where are the cavitations? What do you treat it with? And it's acid fast. Hopefully you enjoyed.